Hello everyone, I'm Dr. Aloysius. Today I'm going to talk to you about the macrovascular complications in diabetes. By the end of this presentation, I hope you'd be able to get an idea about what diabetes is, the complications caused by it, in particular the macrovascular complications, and the things that you could do to prevent or delay these complications. Diabetes mellitus is a metabolic disorder characterized by high blood glucose levels due to defects in insulin secretion, insulin action, or both. Insulin is a hormone secreted by the pancreas in response to food intake. It facilitates transport of glucose from the bloodstream into the cells to be used as a source of energy. There are two main types of diabetes, type 1 and type 2. Type 1 is characterized by complete lack of insulin, whereas type 2 is characterized by insulin resistance, where despite the presence of insulin in the bloodstream, the cells do not respond to it. In later stages, people with type 2 diabetes might also develop deficiency of insulin. There are other types such as gestational diabetes, maturity onset diabetes of the young, and many more, which I will not be discussing today. Poorly controlled diabetes can lead to various complications. They can be classified as microvascular and macrovascular. Microvascular complications are due to damage to small blood vessels, which manifest as diabetic eye disease, kidney disease, and nerve damage. The macrovascular complications are due to damage to the large blood vessels of the body, which affects the blood supply to the heart, brain, and legs, together known as cardiovascular disease. High blood sugars damage the inner lining of the blood vessels, facilitating deposition of cholesterol in the vessel wall. This leads to narrowing of the blood vessels, which is known as atherosclerosis. It also makes our blood cells called platelets more stickier. All these factors increase the risk of clot formation, which can block blood vessels. Blockage of blood vessels supplying the heart muscle causes angina and heart attacks. When the blood vessels supplying the brain are affected, the result is a stroke. It can also affect the blood vessels supplying the legs, causing non-healing ulcers, which can potentially lead to amputations. The risk of death due to cardiovascular disease is 2 to 4 times higher in patients with diabetes. Likewise, foot ulcers and amputations are a major cause of disability due to diabetes. Cardiovascular disease can present with any of the following symptoms: chest pain, shortness of breath and reduced exercise tolerance, weakness of limbs or slurring of speech, leg pain on walking relieved by rest or leg pain at rest, discoloration or ulcers on feet, or loss of sensation in feet. People with suboptimal control of blood sugars, coexisting hypertension or high cholesterol levels, longer duration of diabetes, smoking, obesity, and a family history of heart disease or stroke have a higher risk of developing macrovascular complications. Now that we know the risk factors, can we prevent these complications? Yes, we can prevent or at least delay these complications. Major trials like the UKPDS in patients with type 2 diabetes, DCCT in patients with type 1 diabetes, and the Steno 2 showed us that control of the above mentioned risk factors does indeed improve the outcome. So, let us look at some of these individual risk factors. Optimal control of blood sugars is an important part of management. In general, optimal control would be defined by a HbA1c less than 7%, fasting blood sugars between 4.4 to 7.2 millimoles per liter, and a post-meal blood sugar less than 10 millimoles per liter. However, these targets will have to be individualized depending on patient circumstances and associated medical conditions. Home monitoring of blood sugars by a glucometer is an effective tool to improve your blood sugar control. Your doctor might choose oral medications or insulin injections to achieve optimal control of blood sugars. Coexisting hypertension should be treated aiming for a blood pressure less than 140 by 80 millimeters of mercury. However, if there are signs of complications, the target is even tighter at less than 130 by 80 millimeters of mercury. This can be achieved by a combination of lifestyle modifications and medications. High cholesterol levels should again be treated by a combination of medications and lifestyle measures, aiming for a LDL cholesterol level less than 2.6 millimoles per liter, HDL cholesterol level more than 1 millimole per liter in men and more than 1.3 millimoles per liter in women, and triglycerides level less than 1.7 millimoles per liter. We are going to discuss the lifestyle modifications that can help us prevent complications. It is recommended that adults with diabetes engage in at least 150 minutes of moderate intensity aerobic physical activity spread over at least 3 days per week. In addition to planned physical exercise, other simple changes to the daily routine, such as using the staircase instead of a lift, can be of help. When it comes to diet, there is no one-size-fits-all policy that can be applied to people with diabetes. It is recommended that you eat a balanced diet which includes a variety of nutrient-dense foods in appropriate portion sizes. A dietitian can help you with an individualized meal plan. In general, avoid foods that contain added sugar, fat, or salt. Glycemic index is a measure of the impact of a food item on your blood sugar. High glycemic index foods cause your blood sugars to go higher than low glycemic index foods. Changes in physical activity and diet can help weight loss, which in turn can improve blood sugar control, blood pressure control, and cholesterol levels, which can reduce the risk of developing complications. Smoking cessation is very important as smoking increases the risk of cardiovascular disease and premature death. Hence, if you haven't already stopped, it is time that you seriously considered smoking cessation. As diabetic foot disease is an important cause of disability, appropriate foot care should be an integral part of diabetes management. It is recommended that people with diabetes visually inspect their foot for any blisters, cuts, or scratches on a regular basis with special care to check between toes. It is better to avoid walking barefoot. The shoes worn must be well fitted with adequate space for the toes. If any abnormalities are noted, make sure you see your healthcare professional or podiatrist without delay. That is the end of the presentation. For further information, please refer to www.diabetes.org.uk or www.diabetes.org. Thank you.